family, friends, Cavernoma Alliance regulars who've joined me this morning. Thanks for your support. I'm going to talk about my journey up to this point and then the last few months, more specifically about surgery and what that's been like during COVID. So to start with, for those who don't know me very well, my name's Judith, I'm 38. I get told that sometimes I look younger than I am, which is a lovely compliment, so there we go. I got married in 2013 to Michael, who does the IT support for Cavernoma Alliance and all sorts of other IT as part of his job. My job title is quality engineer. Up until a few months ago, I've been working actively in factories as an engineer on the quality of product for the last 15 years. I was born in Liverpool, so native Scouser, but lived up here in Newcastle for the last 15 years. And I suppose if you ask most of my family and friends, before this journey started, busy would probably be one of the key words they would use for me. I loved doing things. I was not good at sitting on my bottom, which is probably why the last 3 months have been particularly difficult, or this journey's got more and more difficult as it's gone along. Okay, so to start with, initial background. Nobody's ever sure why Michael married me, because my first grand mal seizure was during my sleep when he was still my fiance, and I kicked, hit, punched him, as well as decided that the grand mal would be fun to have with my face down in the pillow. So I know that the following day when Michael finally showed me, I was lovely and rosy as all of my face, all of the little capillaries in my face had popped, and factories, we tend not to wear makeup, but it looked like I had blusher on all day. We spent the next 6 weeks having investigations. We were pretty much advised straight away to hand in my driving license. We were very lucky at that stage because Michael had some private healthcare and gets on very well with his boss. So we were allowed to go and see a private doctor pretty much straight away, who suggested that even though it was only the first seizure, handing in my driving license was the best tactic to take, as it's much easier to get it back if you've voluntarily given it in. The first thing that I can remember the private doctor actually saying was 80% of people who have a seizure never have one again, and we never really find out a reason. So if you hand in your license and nothing happens, you'll get it back in 6 months. So do it, cope. And it was really her first advice. We spent the next kind of 6 weeks, like I said, up until Christmas having scans. Unfortunately, the first MRI that was done was not done very well. I think everybody was in a rush to get away for Christmas, and they didn't really strap my head down very well. For those who've had one, they'll understand that. And Christmas Eve, I remember turning up at my parents' ready to go off and take a youth camp on Boxing Day. To have a phone call from the doctor saying, don't please. And I basically went, what do you mean don't please? And then had a 5-minute conversation about how this unknown shadow on the scan could mean anything from nothing, because it was just movement and the scan hadn't happened very well, right the way through to an aggressive brain tumour. So I got sent off with my father to the largest hospital in Liverpool to find a doctor that we'd managed to phone to get emergency prescription for medications. I wouldn't advise A, going to a hospital on Christmas Eve if you can avoid it, and B, trying to find a pharmacy at 8 o'clock at night. But there we were. On Christmas Day, my dad drove me urgently back to Newcastle, so that I was basically ready to have a scan whenever they could fit me in, and even open the private hospital as an emergency. I then was pretty ill on Boxing Day and spent Boxing Day evening in the RVI waiting for a doctor to have a look at me, check nothing had happened, and to give me some more medication. Again, pretty much as Christmas Eve, I wouldn't advise going and sitting in a major hospital on Boxing Day evening either. probably the scariest ever initial period of my life. I had another MRI, a much more detailed one, sometime between Christmas and New Year, and in early January 2013 was given an initial diagnosis of one cavernoma, possibly a secondary, and some early information, and that's when we joined Cavernoma Alliance. So this is kind of the timeline for the next 3+ years. I suppose the simplest way to describe it is medication trial and error. We spent, and I've probably got a list of 4, if not 5 different combinations of medication that we tried through that time, and several different dosages. As you can see from the beginning of the timeline we've put together there, I had 4 to 5 months off work to get that initial stage of control, which was lovely because it also meant that I could focus very much on my wedding. But obviously trying to balance that and managing changes and dosage changes in medication is never fun. For those who have to do it or have done it, I'd probably say it's a good 3 to 4 month period if you're weaning off one medication and going on to another before you'd really know anything. So give it some level of time, although that's difficult. Up to September 2014, I was fairly lucky and had only had nighttime seizures, so applied for my driving license back and got to drive again, which I know will sound a bit strange to people that you can drive when you're having seizures, but the general logic is if you're asleep, you're not going to be driving. So if that's when you're having your seizures, it's fine for you to drive. I think I've made that make sense. We managed a year when nothing other than some nighttime seizures happened, and we thought, great, we've gotten some control here and we can cope with this new normal, when all of a sudden, September 2015, I was sitting at work towards the end of the day and bang, first large significant daytime grand mal seizure and immediate trip to hospital. And unfortunately, bye-bye went the nice brand new car that I'd just bought. For the next kind of 18 months to 2 years, things basically I kind of described, felt like we were falling off a cliff. Daytime seizures became more and more prevalent, probably a 60-40 mix between more nighttime than daytime, but definitely the daytime just increased and increased and increased. So we went through and had further medications and further suggestions from neurologists at the RVI. I was still only at that stage seeing a neurologist, although it was the 4th neurologist, I think, in 6 years. She's been very good, and we've had her now for 2.5, 3 years. But basically it was a whole period of trial and error, and a further scan in 2018 basically showed that I'd gone from 2 cavernomas to 6 that they were sure about, one being 10 millimeters in size, the others being small but very clear on the scans, and a potential additional 2 cavernoma. So by the time we get to September 2018, this is really the period of time that was all about preparing or pushing initially for surgery. I know the statement September 2018 conversation in Liverpool is kind of vague to everybody, not really to my parents and not to Sandra from Liverpool, who's on today, but basically we have a family friend whose son is a neurosurgeon, and I happened to be somewhere and ended up having a conversation with Jonathan, which was probably the biggest bit of luck that I've had through this whole journey, except for very early on being told about Cavernoma Alliance. He asked how things were going, and politely I said rubbish. That certainly wasn't the word I used. Try 4 letters and rude, but we get the idea. He basically knew of a neurosurgeon in Newcastle he'd previously worked with, and gave me the name and said, get yourself a referral. It sounds to me like your epilepsy is medication sensitive and will never be truly solved by just using medication. So I would suggest speaking to this neurosurgeon and seeing if he would work with your neurologist. He's very friendly, very down to earth, and I don't think you'll have a problem. I think that pretty much describes Mr. Cowie. Friendly, down to earth, not exactly subtle, and very much to the point. Will answer any questions and has done throughout the whole process. We then spent from January 2019 through to, pretty much a year, doing all sorts of the scans and tests that were needed, and MDT meetings happened and all sorts of conversations. And I kind of call that period of time painting with numbers. We did all these tests so that the doctors could get this clear picture. So every test was like a colour. And it basically built up a picture for them in order to make some decisions. By about the end of 2019, surgery had kind of been decided as the next step. And it was a case of them just finalising some bits and pieces. And we were expecting a conversation later in early 2020 about when we could expect surgery and what kind of time frame. And then bang, COVID, lockdown, time frame blown out the window. No idea what was going on. We had a telephone conversation with Mr. Cowie in April, reviewing that we were sure that surgery was the way we wanted to go. He was fairly clear and felt that this was the right tactic, although there was an invasive test that we could have done, but he really didn't think at the current stage it would give us a better picture. And we came off the phone going, yes, surgery is the right thing, but with this unknown time frame at that stage. I happened 8 to 10 weeks later to be sitting at home and the phone rang. For those who have regular appointments at hospitals, I'm sure we all know our hospital phone numbers. So the phone rang, I could tell it was the hospital, and pretty much this nice lady on the phone said something on the lines of, we feel that COVID's kind of coming down, so we're opening our elective surgery lists. Will you have surgery in this period of time? And I remember sitting there with the phone, I'm not sure if I'm on screen properly, with the phone going, pardon? What? And basically the question was asked again, and it was a case of saying yes or going back to this unending not knowing periods of time. And certainly we weren't getting any more success with the current medication protocol I was on. So we said yes, and 5 days later the phone rang again with an initial date of surgery of the 26th of June, which then during the period of the 2 weeks got put back by a week. So that's really kind of the part of my journey that I would call the surgical part of the journey, as opposed to the medication adjusting part of the journey. So what was it like making the decision to have surgery or be in the hospital during COVID-19? So the first thing that's probably different to any normal surgery is going over your surgery with your surgeon on the phone. Is a very strange thing to do. Thankfully, Michael and I had discussed with Mr. Cowie beforehand, so we were clear really on what he was going to do. He kind of showed us on a diagram, and I think even showed us on a skull, to be honest, when we previously sat with him. But it was still quite difficult to repicture that when all we could do was have a phone conversation with him, and we actually had to push for that because he'd gone through the operation previously without saying we wanted another telephone consultation with him. I'd have gone in and asked for him to explain when I was on my own, which was something I wasn't prepared to do, but he did quite happily give us an appointment to just go through the operation and the details again. All the other pre-op was done by nurses over the phone where possible. So all the general questions you get asked about your diet and do you drink and do you smoke and what you weigh and all of those kinds of things that are normally asked face to face was all done over the phone. So it was this half an hour phone conversation answering all the normal questions that you'd get kind of a few weeks before, with a long appointment sitting at the hospital. We were asked to isolate straight away after agreeing to surgery, and the only 2 times that we actually went out between agreeing to surgery and going to the hospital for the surgery itself was for some blood tests for them and MRSA tests for them to get baseline information about 2 weeks before, and then a COVID-19 test 2 days before. The reason that they do a COVID-19 test might seem kind of obvious, but basically it's not the antibody test, to make it clear to everyone. It's the test that says, do you have COVID-19 now? The hospital don't really care if a patient's had COVID-19 in the past and shows antibodies, because they consider that they're not then infectious. So the test that they're actually doing about 2 to 3 days before somebody goes into hospital is actually to decide whether somebody has it now and whether they'll actually admit them or not. Thankfully, everything went okay. I didn't get a phone call that said, don't come in, you have COVID. So about 8 o'clock the morning of the 3rd of July, Michael and I arrived at the hospital. He was allowed in with me, pretty much just to drop me off, stayed about an hour and spoke to the anaesthetist with me. But apart from that, at that stage, he went, as had most people who'd accompanied somebody onto the pre-surgical ward. Pre-surgery, everybody had to wear masks, both the patients and the hospital staff and any of the visitors. But that wasn't too bad because it was only a few hours. I waited about 6 hours on the pre-hospital wards. My general impression of the hospital was quiet. A lot less people walking around than usual, which you would expect because most things where possible are being done over the phone. The nurses generally were very good. I didn't see anyone through my time at hospital having to be told about masks or visors or wearing masks or visors wrong once you were on a ward. You were given less freedom than you would normally have. You were asked to stay within your ward and often even within the room that you'd been given a bed. I went in at a period of time when no visitors at all were allowed. I know this has started to change slightly now. So it was lonely. I probably called my parents a couple of times a day, Michael even more so. People were given the TV for free, which is unusual to kind of give us something to do. But I was very lucky. I was on a ward where in a room with 3 other patients, so there was 4 of us. I wouldn't have wanted to be in a room on my own. I felt that would have been even more lonely at this period of time. And the 3 other patients and I got on very well. Although to begin with, we were all, 2 of us were post-surgery and didn't really stay out. We didn't really come out of our beds. We could all talk. The room wasn't too big. So we probably talked and laughed and learned quite a lot about each other that maybe you wouldn't have if it was a normal time where you were having visitors. The other thing that was probably a bit stranger than normal was any other needs during your stay were done at your bed. So one of the patients was having physio and that was done around her bed, so the curtain was closed and it happened there. She didn't leave to go to a different room. One of the other patients had their speech therapy at the bed again with the curtain closed. So you were trying to give people privacy, but people were conscious that you were in the room while they were having things done, and vice versa. But the hospital were clearly trying to limit people moving around. The only real movement was for scans and that was, when that was done, you as the patient had to wear masks. After surgery, anyone who'd had surgery, anyone on a recovery ward, the actual patient themselves didn't have to wear a mask. Again, fairly logical. All the patients had been tested. None of us had COVID. If we were the only ones unmasked, there was no chance of any transmission. I'm very glad I didn't have to wear a mask post-surgery, as you'll see from the picture on the next slide. I ended up in hospital for 5 days. I didn't feel particularly rushed. That was one of the things that concerned me. The hospital gave me the time to feel like I was safe on my feet and comfortable to move around. We talked about leaving as early as after 3 days, but I felt I wasn't ready, and the surgeon and the hospital staff agreed, supported me, didn't make that decision difficult for me, and I ended up staying for 5 days. Again, when Michael picked me up, he wasn't allowed on the ward, so I was basically waiting by the door, packed, and could see him coming out of the lift just because of where the ward was. So this slide shows why I didn't want, or was pleased I wasn't wearing a mask after surgery. You can see that my wound came down right round this ear, so having anything, this side, having anything round the ear was very, very difficult to start with. So I was trying to not wear my glasses. We actually took one side of the glasses off, and balancing them was a bit strange. And actually wearing a mask, even to leave the hospital, I held it, because again, it was very painful around to have anything around the ear. In the hospital, the wound was covered for the first 4.5 days. This was really only the last half a day where they wanted to just check. Nothing had happened with the wound, and I was very lucky. Everything was dissolvable stitches, so I didn't have to go through having any clips removed. And as you can see, fairly well hidden now that it's healed, at least on the outside, although I can feel the scar tissue, especially in that kind of area if I put my hand through my hair. So what of the remainder of the first 6 weeks, if we say 1 week was in hospital, what was the first 6 weeks of recovery about? The basic guidance on leaving the hospital was to keep my head above my shoulders, which sounds really easy, but is actually incredibly difficult. Your natural reaction when picking anything up is to do this. So everything was about bending at my knees to get down to pick something up, which we tried to avoid as well for the first 2 to 3 weeks. It made me incredibly reliant. Simple things like getting something out of the dishwasher, emptying the bin, putting something in the washing machine, bending down to put food out for the cats, taking a plate out of a cupboard if it was a low down cupboard. All of these things were impossible. You don't think about daily or even repetitive tasks that require you to bend down. So I don't think Michael got a lot of work done. He works from home, because I was on the phone going, can I have a cup? Can you do this? Can you do that? So after the first few days, we learned that the right thing to do was to make sure there was a plate, a bowl, a glass, a cup, all on the side in the kitchen before he went off to do the day's work in his office. The first 3 weeks, so 1 week in hospital and 2 at home, it was also really hard to read and use the computer. Basically, the only way I could describe it was there was just too much on the page or on the screen to focus and concentrate on. Everything was too busy. Even the screen, kind of how you can see it now, probably would have been too much. And I was very tired. I would probably say on average was sleeping somewhere between 12 and 15 hours a day, lots of it cat napping. Just when things got too much, walking around the house was often enough for me to then just sit and catnap for half an hour and things like that. In the first 5 weeks after returning from home, the external wound was still painful. It was healing, the stitches were falling out. We didn't need to recover it. We did have it checked by my mother-in-law, who's a retired nurse, a couple of times when it was most painful, but I was lucky there was never any sign of infection or swelling. It was just uncomfortable. And that was more painful, I think, or more noticeable to me than any internal issue or healing with the wounds. And pretty much I was housebound until week 6. So if you think about the entire period before surgery, where we were asked to stay at home and isolate through surgery, and after, there was somewhere between 9 and 10 weeks where I went as far as poking my nose into the garden or out the front door, but a couple of steps and that was it. At the end of week 6 was the first time that I went further than doing that. So where am I now? If we say tomorrow would be 9 weeks since surgery, it's still really easy to do too much. I think the words busy, busy, busy are still something that I would like to be, and are still something I'm realising that I can't be. And maybe one busy is about as far as we can go once I'm even well, let alone now. So I have to pace my day. I still do things in maybe different ways. I've got a seat in the shower because I find that the heat in the shower is too much to be standing the whole time. I still don't do any heavy lifting. I bend down a little bit, but only if it's going to be fairly quick. But then I also need to remember not to get up too quickly. I haven't, unfortunately, been seizure-free, but we're not worried by that at this stage. The surgeon and my neurologist have said that potentially we're going to have to wait until early November until we have a clearer picture of how well the surgery has gone. My external wound has pretty much healed. We're just talking about scar tissue. And it's clear that the internal wound is healing, but I do have days where I can feel that being quite painful with headaches, particularly in the area of the wound. My major learning, don't rush. It's not going to let you. However much there isn't anything visible particularly anymore unless I move hair out the way. The wound itself and just having any kind of major surgery, same thing. Your body's not going to let you rush however much you might push it. What does this mean in terms of the long term? Well, like I said, we don't know, and we're not likely to know about the success of the surgery for another couple of months. What Michael and I would really hope for is to go back to the stage where I was only having nighttime seizures, not because I'm desperate to drive, because I'm used to not driving by now and it becomes something that's manageable, just because nighttime surgeries mean that, nighttime seizures mean shorter recovery, mean less scary for everybody else, and to some degree are easier to recover from myself. We're conscious that I'll probably still need medication. We were told by my surgeon that there was probably less than a 10% chance that this would stop the epilepsy entirely and stop the need for any medication. We've also discussed with him that there is the possibility in the future of needing further surgery, removing another one or more of the cavernoma that I have, because we believe that the 6, now 5, kind of work off each other and cause the signals that cause the epilepsy as a group. So we're kind of picking off one at a time as we can to see how far we need to go. And the most important thing is to have a decent support structure in place, be that family, friends, people in CA UK who've been through this before. And to be honest, don't hide how you feel. Say when you're scared, say when it's painful, say when you can't do something, be honest with yourself. and the people around you. So thanks for listening.